The broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Thanks for joining us for this webinar called The Healthcare Law and You, How the Affordable Care Act Helps Asian Americans, Native Hawaiians, and Pacific Islanders in Region 5, which is composed of Ohio, Michigan, Wisconsin, Minnesota, Indiana, and Illinois. I'm Paulo Pontmeyer. I'm with the Asian and Pacific Islander American Health Forum. And just a little bit about what our organization does. We're a nonprofit national health justice organization dedicated to improving the health and well-being of more than 17 million Asian Americans, Native Hawaiians, and Pacific Islanders living in the United States, its jurisdictions, which includes its territories, and elsewhere. We believe that all persons have the right to be healthy, the right to live in a thriving community, and the right to quality, affordable, and accessible health care. We recently celebrated our 25th year of existence, having been founded in 1986 in San Francisco, where we're headquartered. Fortunately, we also have a Washington, D.C. presence from where I'm based that allows us to work with lots of our federal partners and national health organizations in the nation's capital. And lastly, the mission of the Health Forum is to influence policy, mobilize communities, and strengthen programs and organizations to improve the health of the Asian American, Native Hawaiian, and Pacific Islander community. And so, welcome to our webinar. We are joined by a panel of very esteemed presenters that we have worked with in the past, starting with Lina from the U.S. Department of Health and Human Services Region 5, who will be talking mainly about the federal HHS initiatives within the ACA and giving us a broad overview of what the ACA actually does for our communities. Following her, we'll be joined by Doua, who is a commissioner with the White House Initiative on Asian Americans and Pacific Islanders, and we also work closely with her in her day job as the executive director of the Southeast Asia Resource Action Center here in Washington, D.C. So she's a really great friend to the organization. Following her, we'll have two presenters from Asian Services in Action, starting with Michael Byun, who is their executive director and also one of our local partners in Ohio. And we work very closely with him and are excited to hear what his organization is currently doing and will be doing as the ACA becomes implemented fully in the next coming years. And lastly, we have Deborah, who is also with Asian Services in Action, who will also be co-presenting with Michael. And I want to make sure that we have enough time for questions because it looks like we'll have a really packed agenda and great discussion. So without further ado, I'd like to turn it over to Lina to talk us through about the healthcare reform pieces of the Affordable Care Act.
Well, thank you for that introduction. My name is Lina Rashid, and we work within the Office of the Regional Director, Kenneth Munson, to work with the Region 5 states on the Affordable Care Act. So we're really happy to be here with you today and be able to talk about the law. We're going to be going over how the Affordable Care Act improves access to quality, affordable care. And we also know that there's a need to address healthcare disparities, which the law tries to do as well. So one of our goals is to communicate what this law means. And at HHS, we're working on implementing this law as well as communicating what this law means for communities. So we're here to be partners with you and hope you'll be able to take this information, share it with your communities, with your neighbors, and with your friends so that we can work together in making sure people are informed. There's a lot of information on this law that we will be able to cover in the next 15 minutes or so. So we want to encourage you to visit www.healthcare.gov, which is our website that talks about different insurance options. So moving forward to the next slide, you can see that we wanted to start with just what the problems are in our healthcare system. We know that we needed health reform because it was working well for insurance companies but wasn't working as well for American families. Historically, people with pre-existing conditions had difficulties getting insurance, and when they did have insurance, they were worried about it dropping or not being covered when they were sick. We know that in total, about 15 million Americans are uninsured, and there are tens of millions more who are underinsured or aren't getting the preventative care that they need. So overall, an estimated 18% of Asian Americans and Pacific Islanders are uninsured, compared with about 16.3% for the national average. And that works out to about 1 in 7 in the AAPI community are uninsured. On the next slide, we also know that there's an economic cost to the need for health reform. Currently, we were spending about 16% of our GDP on healthcare in 2009, and without reform, that was expected to reach almost 31% of our gross domestic product by 2035. We also know that there's a human cost to people not having health insurance, and we know that about 72 people who died prematurely every day from the lack of health insurance. And for all those reasons, as you'll see on the next slide, we passed health reform, and in March 2010, President Obama signed the Affordable Care Act into law. We know that since the law was passed in these 2 years, we've made significant progress. Just to touch on some of the trends, we know that healthcare spending is growing at a slower rate. We know that national healthcare spending grew at only 3% in the past 2 years compared to about 6% in 2000 to 2009. We know that premiums are also growing at a slower rate. And we know that we've improved the solvency of the Medicare Trust Fund, which is now estimated to be solvent until 2024 instead of 2016. So moving on to the next slide, these are some of the themes that we're going to cover in this presentation today in terms of how the Affordable Care Act is expanding coverage, offering new protections, and making healthcare more affordable with better quality care. We're also making significant investments in prevention and public health with this law. And it's important to remember that the Affordable Care Act is really putting our budget and economy on a more stable path by reducing the federal deficit by over $100 billion in the first decade and by more than $1 trillion in the following decade, thanks to the Congressional Budget Office estimates. So the next slide shows you the Patient's Bill of Rights, and these are the new protections that are already in effect and started in 2010. It's no longer legal for insurance companies to deny coverage to children because of a pre-existing condition such as asthma or diabetes. We also know that they can no longer place a lifetime cap on how much care they will provide if you do get sick. And this can help people who have been injured in a car accident or develop a serious condition. They no longer have to worry about their health care coverage disappearing when they need it the most. It's also no longer possible for insurance companies to deny coverage to individuals by finding a mistake in their paperwork. So for example, in the past, when an insurance company asked, is there anything else relevant that we should know about? One example I'll give you is for Katie, who had a psychologist visit 6 years earlier and didn't remember to put that in her application. Later, she found out she had breast cancer and submitted her claim to her insurance company, and once they discovered the psychologist visits, they decided that they would take away her coverage even though she'd been paying her premium. So that no longer can happen as a result of the law. The next slide talks about one of the steps we're taking to make healthcare coverage more affordable. So in the current market, if sometimes insurers were spending almost half of people's premiums on overheads such as marketing or CEO salaries and only spending about 60 cents of every dollar on care. The Affordable Care Act created the medical loss ratio requirement, and what this really does is protects about 75 million insured Americans who have health insurance to make sure their dollars are really going towards health care. So what this rule does is it makes insurance companies have to spend 80 to 85% of their premium dollars on medical care and quality improvements rather than administrative costs. And this rule started in January of 2011. As a result, insurers now have to spend at least 80% of their healthcare dollars on actual healthcare services. And if they don't do this, they have to provide a rebate to the consumer no later than August 1st, 2012. And consumers can get their rebates in several different ways. It may be a rebate check in the mail, a lump sum reimbursement to their debit card, a reduction in future premiums, or the employer will try to provide those benefits to employees. We're estimating that this will help about 13 million Americans who will receive about $1.1 billion in rebates in future premiums. This comes out to about $151 per family. In the next slide, we're talking about insurance premiums. And so before, insurance companies could raise premiums by double digits without any justification. What we're doing with the healthcare law is, for the first time ever, making insurance companies publicly justify any rate increase of 10% or more. And then we're also giving new resources to states to review and block premium hikes. So what we're doing with this law is already we know many states have reported the number of insurance companies requesting rate increases over 10% has significantly decreased over the past 9 months. And all this information will be published on healthcare.gov. On the next slide, we see some examples of how this has been working across the country. For example, Connecticut's insurance department rejected a proposed 20% rate hike on one of their major insurers, and we've already seen that this transparency is bringing the marketplace, or helping the marketplace to reduce premiums. The healthcare law also helps make healthcare more affordable for small businesses, which we know are paying about 20% more for their premiums than larger employers. So to provide this relief, the law is helping small employers that are offering health coverage pay for that coverage. And what we're doing is if you are a small business or small for-profit or nonprofit employer with 25 full-time equivalents with wages of less than $50,000, you could be eligible for a tax credit from 2010 to 2013. And that'll go up in the premium up to 50%, going up to 2014. So far, this is eligible for nonprofit and for-profit employees. About 360,000 employers have taken advantage of this credit to help about 2 million workers thus far. And in 2014, the small business tax credit will go up to 50% for for-profits and 35% for nonprofits to help make coverage more affordable. We also know that thanks to the personal responsibility requirement in the law, that those American families who've been paying about $1,000 in hidden taxes and extra premiums compared to those who aren't offering coverage are going to be able to help with their taxes as well, because everyone will be paying into the pool to help make sure that we aren't paying for those that don't have health insurance. In the next slide, we're talking about one of the ways that the healthcare law is making access to affordable care more available. And one of those benefits is that young adults are now able to stay under their parents' plan up to age 26. This is regardless of whether they're in school or living with their parents. Regardless, they're able to stay under their parents' plan. This has helped about 3.1 million young adults so far, and of that, there's more than 97,000 who are Asian American and Pacific Islander, according to our latest report. On the next slide, you see that the Affordable Care Act also has some stopgap measures. There's going to be lots of changes in 2014 that will make healthcare more affordable, but until then, we started the Pre-Existing Condition Insurance Plan, which is a program for those who are uninsured, have for the past 6 months, are living in the United States and are U.S. citizens with a pre-existing condition. So this is a program available in all 50 states. You can go to www.pcip.gov for more information. And about 60,000 Americans who have a health condition, whether that be breast cancer or heart disease, are already enrolled in this program right now. On the next slide, we're talking about the preventative services that are now available for free. We know that getting the right preventative care like cancer screenings and vaccines is one of the best ways to stay healthy, but too often many Americans go without this kind of care because when it comes to a $50 mammogram or $50 for groceries, too many people are taking their chances. So thanks to the law, people don't have to make that decision anymore. In new plans, there's a wide range of preventative services that are available for free. And that won't just help people stay healthy, it'll help them avoid costly health conditions down the road. You can see kind of a list of benefits, whether that's mammograms or colonoscopies, cholesterol screenings, tobacco cessation and counseling, and depression screenings. Those are some of the services that are available. We also have specific women's preventative services, such as birth control and wellness visits and breastfeeding, that'll be available on August 1st for women everywhere. And that'll be for new private plans as well. There's an estimated 2.7 million Asian Americans and Pacific Islanders with private insurance who are going to have access to these expanded preventative benefits. On the next slide, we're talking about how the law is strengthening Medicare. So I mentioned the preventative services earlier in the previous slide, and one of the ways that we're helping with the Medicare program and about the almost 900,000 elderly and disabled Asian Americans who are getting preventative services thanks to the Affordable Care Act is through the Medicare program. These benefits include an annual wellness visit, which includes personalized prevention plans, so that you can really have a conversation with your doctor and talk about what screenings might be helpful and services such as diabetes tests, bone mass measurements, mammograms, hepatitis B, and pneumococcal shots. This is particularly important for the Asian American community as they're 29% less likely than Caucasians to receive the pneumococcal vaccine. We also know that cancer screenings are particularly important for Asian Americans and Pacific Islanders who are less likely to undergo mammograms, pap smears, or colorectal screenings. The law also requires insurers to cover HIV screenings without cost to individuals with high risk for infection. We also are reducing the cost for prescription drugs. So their Medicare prescription donut hole did not offer coverage when you fell into the donut hole. And so to help with prescription drugs, it gives beneficiaries a 50% discount on their brand name drugs. In the past, many fell into this hole and couldn't afford their premiums, and now seniors are getting about $600 in relief, and the donut hole we closed in 2020. We're also reducing fraud in the Medicare system, and in 2010, we were able to return about $4 billion. And this law is giving enforcement more tools for those who are stealing money from Medicare. We also want to improve the way we're delivering care. So we know that many individuals who are in the Medicare program have multiple chronic conditions and may see almost 14 different doctors per year. So we want to improve our health system to help make sure we're focusing on prevention, working closely to coordinate care, and deliver the best care that we can to patients. Since the law passed, Medicare costs have actually been going down, and this year in 2012, average premiums for Part D on Medicare Advantage will be lower than they were in 2011, and Part B premiums will go far less than was predicted. So in the next slide, we're talking about the improvements that are going to come. I mentioned the year 2014 earlier, and there's a number of improvements that will take place then. One of the major improvements is that there will be a new marketplace called Affordable Insurance Exchanges, which will be competitive private marketplaces that will be created in every state for families and small business owners to purchase health insurance. These will function kind of the way Expedia or Orbitz are for health coverage, so you'll be able to go into a website, easily compare your options in one place, and you'll have access to the exchange to identify which source of coverage is the best option for you, which may be one of the private plans in the marketplace or a public program like Medicaid. This law also includes a few specific rules that will take place in 2014 to be in the best interest of consumers. So people won't be able to be denied for a pre-existing condition. I mentioned that earlier was already covered for children, and this will be in place for adults in 2014. They will also no longer be able to charge women more than men for the same premium. For example, they could charge a female 150% more than the same 22-year-old male, and that no longer will be the case. There's also significant tax credits to help people purchase health insurance, and there'll be better access to Medicaid, as mentioned earlier. Members of Congress will also be purchasing their health insurance out of the same marketplace. New estimates we have from RAND suggest that about 2 million Asian Americans who would otherwise be uninsured will be covered or eligible for coverage through the expansion of the Affordable Insurance Exchanges and Medicaid. The Affordable Care Act will expand Medicaid coverage to include individuals that are at or below 133% of the federal poverty level. That's about 30,000 for a family of 4, and about 14,000 for an individual. And this will include adults without dependent children who are living at home, which weren't typically covered in the Medicaid program, and that'll be an option for states if they'd like to expand their program. It's important to remember the new federal matching rates will provide 100% of federal funding for newly eligible people in the Medicaid program, and that'll be from 2014 to 2016. After that, the federal matching rates will gradually reduce to 90% in 2020, while they'll remain permanently. So moving on to the next slide, just to go in a little bit more detail about what this exchange will look like, is we're trying to make it possible for people to easily compare plans based on benefits and know that they're comparing apples to apples instead of apples to oranges, because there'll be a minimum set of benefits that'll be covered. It's important to remember that all Americans will have access to the Affordable Insurance Exchanges by January 1st, 2014. And states have the option to either build these marketplaces on their own or in partnership with the federal government through the state partnership model, or to have the federal government running these plans. So states will have to tell the HHS of their choice or decision by November 16, 2012. There's funding opportunities to develop these new marketplaces, which are 100% federally financed by the federal government. And on June 29, 2012, we actually announced a new funding opportunity. To date, 34 states and the District of Columbia have received approximately $850 million in exchange establishment grants to build progress towards building these new insurance exchanges. All of the Region 5 states have currently received funds and are in the process of working with HHS to help develop these marketplaces for consumers. And the next slide, I just wanted to offer this as a visual to kind of see what the new marketplace will look like and what some of those options will be. As mentioned, if you are below 133% of the federal poverty level, you could be eligible for Medicaid coverage, which is about $30,000 for a family of four, $14,000 for an individual. If you're in that in-between category, you could qualify for premium tax credits to help you purchase health insurance through the exchange. So that's going up to about $88,000 for a family of four, which is about 400% of the federal poverty level. And then there also may be individuals who don't qualify for those tax credits but are still purchasing their health coverage through the exchange as a private marketplace and as a private option. We also know that we need to address healthcare disparities, and the law has offered a lot of different tools to help with those benefits. So for example, we are trying to better coordinate care because we know the rate of illness for chronic diseases such as diabetes, kidney care, et cetera, are more complicated. We're also trying to improve the diversity and culturally appropriate care that we're delivering. And so one of the things that will be happening is health plans will be required to use language services and community outreach in underserved communities. We're also improving initiatives to make sure that there's more providers that are in racial and ethnic diversity and expanding those professions as well. The Affordable Care Act also includes those initiatives specifically for the Asian American Pacific Islander community because we know that improved doctor-patient communication is particularly important. Asian Americans are also most likely to be born outside of the United States, about 66.7% compared to about 8% for whites, and speak English less than very well compared to whites as well. We also improved data collection by improving new funding that will be available to collect information on how women and racial and ethnic minorities experience the healthcare system, because we know if we understand this better, we can also improve the system. Unfortunately, when it comes to minority populations, it's often hard to have a localized picture of healthcare in our communities, especially when we try to drill down further and further in our ethnic communities. So the Affordable Care Act included a section that includes new national federal data collection standards, which will collect data in 2012 based off of race, ethnicity, primary language, disability status, and gender. One example is that Native Hawaiians and other Pacific Islanders are such a small subgroup that often we don't have a sufficient sample to survey them and get reliable statistics. We also know when they're reported separately, we know that this community suffers from many health disparities. So an example of a statistic we've been able to find is that Native Hawaiian and other Pacific Islanders have the highest percentage of adults with no office visits in the past year. And the Affordable Care Act provisions are particularly important because now we have that information and we have that data to move forward. We also wanted to mention in the next slide some of the other ways that we're trying to improve the healthcare and reduce health disparities. Preventative care will be eligible, such as the ones we mentioned earlier. We know that we'll be able to end insurance discrimination, where now people who don't have coverage because they have an illness will be able to get it, and that women won't have to pay higher premiums just because of their gender. We're also expanding the healthcare workforce, and thanks to these investments, there's a program called the National Health Service Corps, which has been expanded, which provides scholarships and loan repayment programs to healthcare professionals to serve in underserved communities. The Affordable Care Act is providing about $1.5 billion over the next 5 years for the National Health Service Corps. We're also expanding community health centers, which are a safety net for low-income individuals and families. And the Affordable Care Act is expanding these funds to provide $11 billion over the next 5 years for operation. There is estimates to show that about 700,000 individuals who are Asian American or Pacific Islander are using community health centers right now. We also at HHS have developed an action plan to reduce racial and ethnic disparities, which outlines goals, strategies, and actions from HHS that we are taking to reduce healthcare disparities among racial and ethnic minorities. And this will build around some of the tools in the Affordable Care Act to help improve healthcare further. Lastly, I wanted to once again direct you to www.healthcare.gov. That is our website where you can find insurance options and see which opportunities may be there for programs that may be helpful. I have my contact information as well as the regional director's contact information. We're both happy to assist you with any of your outreach efforts in your states or just be a resource to you moving forward. So with that, you'll be hearing some more information and from the other speakers. You'll also be getting more information from us at HHS on what the new marketplaces will look like and other updates. You can email me at lina.choudhryrashid@hhs.gov to see if you have any further questions or if you'd like to add it onto our weekly updates on the Affordable Care Act. And we also know that there's been a lot of analysis on the Supreme Court decision and its effect on the Affordable Care Act, and we're continuing to move forward to put in place the critical provisions of the law so that we can make sure individuals and families are getting the health care that we need and improving our system forward. So with that, I'd turn it over to the next speaker, and thank you for your time today.
Great, thank you, Lina. Now I'd like to turn it over to Doua to talk about the work that the White House Initiative on Asian Americans and Pacific Islanders are doing.
Thank you. Again, my name is Doua. I'm the Executive Director in my day job to the Southeast Asia Resource Action Center, and we're a national organization based in Washington, D.C. that works with refugee populations from Cambodia, Laos, and Vietnam. I'm also one of the commissioners on the White House Initiative on Asian Americans and Pacific Islanders, and I'm going to talk very briefly, but mostly about the initiative. I myself also grew up in Michigan, so I recognize that much of the time when we're talking about Asian Americans and Pacific Islanders, we're talking about either the East Coast or West Coast, but we forget about our growing communities in the middle, and so I'm glad to be on this call to be able to talk a little bit more about what the White House Initiative is doing that impacts newer immigrant communities as well as everyone across the country. Just so that you know, and for those who may not be aware, the initiative was established by President Clinton, and it's currently chaired by two cabinet-level secretaries. One is Chris Liu, and one is Arnie Duncan. And the initiative itself was reconfirmed by President Obama. Our executive director is Kiran Ahuja. Some of you may or may not have met her through different events throughout the country. And I think what we can do at the end is also offer up her contact and Kate Morales, who is the lead staff on health issues over at the White House Initiative, so that people can follow up. The staff work directly with the President's Advisory Commission, which there are 20 of. I'm one of them. And they're leaders from across the country. Our commission is chaired by Daphne Kwok, who is based out of San Francisco. The initiative itself has 4 areas of focus: healthy communities, economic and community development, civil and immigrant rights, and educational opportunities. And the goal of the initiative is to ensure that the federal government works better for Asian Americans and Pacific Islanders, and often we serve as a liaison between community and federal agencies. Since the initiative was reauthorized by Obama, the initiative itself has held over 200 events in 25 states, D.C. and the Pacific Islands, reaching more than 25,000 different community members. We've also held a number of webinars and conference calls to increase knowledge about federal efforts that impact Asian Americans and Pacific Islanders. These include everything from working on specific public policy issues all the way to connecting with different federal agencies. The initiative itself has a mandate and is working with 23 different federal agencies, which each have a plan focused on how to better engage our communities. So for example, the HHS plan for Asian Americans and Pacific Islander focuses on health disparities and addressing health issues prevalent in the Asian American Pacific Islander community, such as hepatitis, cancer, and diabetes. You can actually find these plans at the White House Initiative website, which I'll offer up at the end. The HHS plan also plans to support data disaggregation, which will allow for the department to collect data about specific groups in the Asian American Pacific Islander population. As mentioned earlier in the prior presenter, the new Affordable Care Act is an opportunity for by which we can do that. And we have a couple of health professionals on our commission. One of them is actually Dr. Tung Nguyen out of San Francisco, who really talks about the Affordable Care Act being a critical tool for Asian American Pacific Islander communities. We know that there are up to 2 million uninsured APIs, and that actually many of them will benefit from the Affordable Care Act by getting access to insurance, which was already mentioned earlier on. The initiative also works to increase awareness of benefits and provisions of the Affordable Care Act through a number of blog posts, webinars, and events. I hope that if you haven't already gotten information from the initiative, you can sign up and get additional information also on the website. Most recently, we actually held a regional summit in Atlanta for the Southeast region. The goal this year for the initiative is to focus on areas that haven't traditionally had the kind of spotlight that we would like them to have. So the summit in Atlanta had over 500 participants. We recently just also held another summit in Ohio, which Michael Byun and his team will mention a little bit about their work in Ohio with Asian American communities. But there was a strong focus on the initiative this year to look at states that haven't been highlighted in the past. The initiative is also focusing on reaching out to newer immigrant communities from the Asian American Pacific Islander population. For example, there's a community meeting in Oakland that included community members from the Mongolian, Burmese, and Bhutanese communities. The idea is that a lot of these populations, because they are newer, are often lost, and the hope is to connect them to some of the current resources and current Asian American Pacific Islander community and community-based organizations that already exist. So we have a couple of upcoming events in the New York region, including a roundtable in Jersey that will include discussions on health and immigration, and a roundtable in Queens where representatives from federal agencies will visit local community-based organizations. Overall, we really want to ensure that the Asian American Pacific Islander community voice is heard as planning implementation of the ACA occurs. If you're interested in staying up to date or getting more information about the initiative, you can visit our website at www.whitehouse.gov/API, and we'll have the Health Forum team post all this information at the end of the full presentation. And I'll stay on, and I look forward to any questions that anyone might have. Thank you, Paulo.
Thank you, Doua, for that presentation. And so I'd just like to hand it off to our last set of speakers from Asian Services in Action. So the floor is yours.
Thanks, Paulo. Again, this is Michael Byun, Executive Director of Asian Services in Action. And what I would like to do on the next slide is just provide a little bit of background about our organization here in Ohio. Our organization was founded in 1995 by 4 Asian immigrant women. And then originally we started out with basic health screenings in the community, but eventually we've become a comprehensive multi-service health and social service agency, meeting the unique needs of our communities here in northeastern Ohio, which also include the city of Cleveland. Our mission is really to focus on empowerment and advocacy for our communities and to provide them access to linguistically and culturally appropriate care and services. On the next slide, I want to briefly talk about our Community Health Promotions Department, which is one of our 5 interconnected departments. Within our Community Health Promotions Department, we offer interpreting and translation, working with health systems, social service agencies to reduce language as a barrier for our communities to access services. In addition to that, we offer community-based testing, screening, and outreach opportunities. And most recently, we've covered a number of different health-related areas, including type 2 diabetes, cancer, HIV testing, childhood-led prevention, and immunization. Our education and outreach also include work doing community-based in community settings, workshops and trainings in language, working with community health outreach workers in the area of diabetes prevention and hepatitis B. On the next slide, I want to just highlight the 3 key areas in which our organization has worked in relation to the Affordable Care Act. Most important one for us right now is our work in creating the first federally qualified health center serving Asian Americans and Pacific Islanders here in Ohio. The other is working on a policy front in informing and engaging those who are involved in policies and practices as it relates to addressing health issues in our communities. And so we've been working on a project that involves the Community Transformation Grant. And the last piece is specifically on what was touched upon earlier by Lina with regards to work around the health insurance exchange. And Deb Wang will be providing some greater detail about our outreach and education efforts to engage our communities in the process. So the next slide highlights our work on the federally qualified health center. Here in Ohio, we have a very unique situation. Our communities are geographically fragmented, so many of them rely on a hub like the city of Cleveland, where there's a concentration of businesses, social services, and other amenities. So they travel long distances to access services. One of the things that we recently identified was that our communities were regularly taking chartered buses to New York City, despite the fact that we have world-class health system, including the Cleveland Clinic in our area. So for this reason, we embarked on this project to explore the need for a federally qualified health center. There are some other factors that have led us to explore this as an organization, one being that the county-based health clinic, which has two exam rooms in our community, recently announced that they were going to relocate to a predominantly African-American part of the city, which make access a major challenge. So as part of our work, we had received a federally qualified health center planning grant from HRSA last year. And so we're working through the process right now to put together the plans necessary to become an FQHC lookalike or an FQHC. Our hopes are to open our health center, the International Community Health Center, in October of 2012 this year. The next slide shows our work around the Community Transformation Grant. We're working with a national partner called APPEAL, which stands for Asian Pacific Partners for Empowerment, Advocacy, and Leadership that is based in Oakland. And we are working as part of 7 communities across the country, including the jurisdiction of Palau, to raise awareness around culturally and linguistically specific strategies, policy strategies, and help to disseminate some of those best practices among different sectors of our partners here in our communities, including public health, community development, funders, and so forth. As part of our work, as Doua had mentioned, we organized with the White House Initiative the first ever Midwest Regional Action Summit, which drew from 5 of the 6 Region 5 states to Columbus, Ohio on July 13th. We had over 300 participants from all over the region, and we engaged high-level federal officials from various agencies, including HHS, HUD, Department of Labor, and so forth. So it was a really great event for our communities to come together and share challenges and concerns with federal officials. We also had the highest-ranking Asian American in the Obama administration, Chris Liu, attend and engage with our communities. On the next slide, I want to talk a little bit about our work with the Health Insurance Exchange, and specifically in terms of our work to do outreach and education with regards to the implementation of the Health Insurance Exchange, which is really a critical component of the Affordable Care Act. And as part of our work, we've been working locally at the state level as well to contribute specific AAPI strategies, whether that is the recommendations with regards to who the patient navigator should be, and the importance of engaging our community-based organizations to identify culturally relevant and bilingual community navigators who are going to be essential in the implementation of the Health Insurance Exchange. And also in terms of engaging AAPI communities in the discussions at the state level as we move forward in implementing the Health Insurance Exchange. So at this point, I want to pass this over to Deb Wang, who's our policy communications staff here, who's going to talk a little bit further about our work in the Health Insurance Exchange outreach.
Great, Michael. Thank you. So in the final slides here, I'm going to be going over, or I'll be reviewing what the Health Insurance Exchange is, and that I will then go into Asia's work on engaging AAPIs in the Health Exchange, in Ohio specifically, and then I'll end briefly with the status of implementing the exchange in Ohio. So just to review briefly, like Lina already mentioned, an exchange is basically a health insurance marketplace where companies will compete for health consumers and also where members of Congress will also purchase their insurance. The best way to visualize the health insurance exchange is it's going to be like a Travelocity for insurance. It's going to have this easy-to-use website built for comparison shopping of health plans. The Affordable Care Act calls on each state to establish its own exchange by 2014. And on the next slide, there are a few things that the exchange is going to need to most effectively reduce AAPI health disparities in Ohio. Those things are, we believe, that the exchange should be run by Ohio instead of being federally run. I'll go into that a little bit later. It should provide multilingual access, so both the website itself should provide AAPI language support, and also the navigators that Michael mentioned earlier, the organizations and people who will help consumers choose and compare their health plans, should also be culturally competent. It should be run by a pro-consumer governing board, meaning that the governing board should be made up of consumers themselves, small business owners, and insurance experts, and should exclude people with a stake, a financial stake in the health insurance system, such as hospital representatives or physicians. And lastly, the exchange should have effective regulation in terms of making sure that health plans that are sold inside of the exchange match health plans that are sold outside of the exchange. In other words, we want to make sure that the options inside the health insurance exchange are every bit as high quality as anything you can get outside of the exchange. So on the next slide, I can go into exactly what Asia has done to raise awareness of the exchange among AAPIs in Ohio. From February to June of this year, we partnered with the Universal Health Action Network to raise awareness of the exchange in Ohio. We identified and trained key AAPI leaders around the state, specifically in the 5 urban areas of Ohio, to publicly advocate for a consumer-friendly, culturally competent exchange. And both representatives from Asia and our partners from around the state reached about 240 people through multiple presentations on the exchange at various events such as festivals, PTA meetings. We had an AAPI legislative day in June where we convened a lot of civically minded AAPIs from all over the state in Columbus, and we also had a presentation there. And basically, we wanted to engage our community in the implementation of the exchange, because the exchange can be a very promising thing if implemented correctly, and we wanted to make sure that our communities knew exactly what to advocate for in terms of culturally competent navigators and a pro-consumer governing board to make the exchange work for AAPI health consumers in Ohio. Next slide, please. From February to June, we also, here at Asia, developed fact sheets on the Affordable Care Act and the exchange in multiple languages to reach out to the grassroots of our community. Those fact sheets were translated into Chinese, Korean, Laotian, Punjabi, Cambodian, and Vietnamese. I've included links to the 2 resources that we developed, and when the presenters send out the slides to everyone later, you can click on those and see the PDFs. And lastly, we also wrote letters to the editor, some in language, some in English, to local and ethnic media, informing people about the exchange and advocating for a culturally competent implementation of the exchange in Ohio. And on the last slide, I wanted to touch briefly on the status of the exchange in Ohio. There is legislation pending in the Ohio legislature to establish a state-run exchange. Unfortunately, the political climate in the state isn't very friendly to the implementation of a state-run exchange at the moment. Just a few weeks ago, Lieutenant Governor and Insurance Commissioner Mary Taylor stated that at this point we are not going to set up a state-based exchange. So it's unlikely that Ohio will apply in time to establish an exchange by the November 16th deadline that Lina mentioned. This means that the federal government, the U.S. Department of Health and Human Services, will set up Ohio's exchange in January 2014. So Ohio still will have an exchange, but it will probably be run by the federal government. As healthcare advocates, this was not ideal for us. We felt that a state-run exchange would be most flexible and responsive to the needs of AAPI Ohioans specifically. So I look forward to answering any questions that anyone might have. Thanks for tuning in today.
Thank you, Asia Inc. So now we have just a couple of minutes to have some questions, and the way that we can do these questions are in your webinar box, you'll see an option to be able to type in a question. And for the format that we've done for this in the past is we'll review the question and hopefully assign it to the right presenter to answer that question. And if we don't get any questions, we will just end our webinar early. So please feel free to ask any questions that you have. Okay, so one of our first questions that we have is targeted for our representatives from HHS and the White House Initiative, and it's a question talking about what are some specific issues that concern Asian Americans and Pacific Islanders when they try to talk to their state legislatures about establishing healthcare reform in their states.
Well, this is Lina. I can start off with kind of some thoughts. So as I take it, the question is, what should people be raising with their state legislators regarding health reform? And I think the important thing about the law is that there's tools in the toolbox to help move it forward, and it's up to states to determine which of those tools they want to take advantage of. So in terms of the new competitive marketplace, the health insurance exchanges, seeing what they think is the best option for their state, in terms of whether that's state-operated jointly with the federal government or a federal exchange. The other, I would say, would be the expansion for Medicaid, which states have the option of whether they'd like to expand Medicaid to those newly eligible individuals with the federal match. There's also consumer assistance programs that can be offered to help with enrollment and making sure we have more culturally appropriate materials that way. So that's another program that I would encourage people to take advantage of and encourage people to learn about and talk with their states about that.
Paulo, I can add a little bit. I think part of the dilemma in our work that's happened in the Midwest is that a lot of state elected officials don't know that much about Asian American Pacific Islander communities, so they don't know that the Affordable Care Act actually could help us and support our communities, especially in areas around language access. I think many of you already know on the phone that people think Asian Americans are the healthiest, we are the wealthiest, and it's often in their minds the first time that they've had a community or constituent member come to them and say there actually are health needs and this is where the Affordable Act can be helpful. And in many of the slides that both Lina and Michael and his team put forward, a lot of that information was there, but some of it is just basic education for those elected officials about the importance of this new law and what our populations look like in their states and in their districts. Many of them actually haven't heard from our constituents in those areas.
Thanks, Deborah. So we have one more question, and I think this will be our last question, and it's I would like to direct it to Michael and Deborah about how this person is, let me just read this, not in Ohio, and is wondering if there are any other partners in Region 5 that you all work with that that you know of that are in either, states other than Ohio. So I could have just expanded that you guys work with closely in Region 5.
Thanks, Paula, for that question. I think the Midwest Regional Action Summit that we had recently completed with the White House Initiative really is a testament of this growing and emerging collaboration that is taking place in the Midwest. We work very closely with a number of key organizations who are largely pan-ethnic in dimension in areas such as Illinois and Chicago, in Minnesota, in Indiana, and also Michigan. So the work is really important, and there's some opportunities down the road that allow us to kind of convene and come together. I want to put a plug in for an upcoming event conference called the Advancing Justice Conference, organized by Asian American Justice Center and their collaborative, scheduled at the end of September. But there will be an opportunity for Midwest communities to come together again at that time to do some planning, some strategizing, to look at ways that we can work together, especially as part of Region 5.
And this is Deb. If I could just add, if the original asker of the question would like more information about any of the partners we work with in the Midwest, he or she can feel free to shoot either of us an email, and we'd be happy to answer more questions.
Thanks, guys. And I know that we said that that was going to be the last question, but we actually have one more question about having these slides being shared after this webinar. And I'll just take a privilege and say, yes, we will be sharing these slides after we get approval from the initiative and HHS as to what the final slides will look like. And we are recording this webinar, so we will get that once we get approval from those bodies. And with that, I'd like to thank everyone, especially our speakers today, for presenting on this webinar. We know that it's a very busy time in everyone's schedules, and for everyone to come together for 1 hour to explain how this historic law is changing the lives of our communities, especially the Asian American, Native Hawaiian, and Pacific Islander community, is a testament to kind of how we can come together at a national level to really promote and help bring about change and positive change for our communities. And with that said, please contact us at the Asian Pacific Islander American Health Forum. Our contact info is on slides. And if no one has anything else to say, thanks, and have a great day.